Have you ever felt a constant tingling in your feet, and no one really explains why? That discomfort that comes out of nowhere, as if your limbs kept waking up every few moments, can make you stop dead in the street or interrupt your night's rest. And you might think it's just a passing thing, another simple tingle, but the truth is that this signal can affect your quality of life, and in some cases, increase the risk of falls or injuries. Today we're going to dive deep into 5 possible causes that doctors don't usually explain clearly. Causes that might be behind that persistent buzzing in your feet, and that once you know them, will let you take action before they become a bigger problem. Not all tingling sensations are the same. Sometimes it's a harmless symptom, and other times it's a warning that something isn't working as it should. Over the next few minutes, you'll discover why poor circulation, nerve compression, diabetic neuropathy, nutritional deficiencies, or even lumbar spine issues can provoke that persistent tingling. I'll explain how each of these conditions interferes with nerve signaling and how to recognize their warning signs. Before we continue, I'd love to hear from you. Where are you watching this video from, and how old are you? Leave it in the comments. I can't wait to read and see if we're on the same page. If you've ever wondered, why do my feet fall asleep? Stay until the end. There are details they're not telling you that can make all the difference in your daily well-being. Let's get started. The first cause we'll explore is poor peripheral circulation, a problem that prevents blood from flowing normally to the extremities and which may be the reason for that constant tingling in your feet. Our circulatory system works like a network of roads. The heart pumps blood through major arteries, and then it must travel along smaller roads, the peripheral arteries and capillaries, down to the toes. When those roads narrow or become blocked, the flow slows and the nerve cells stop getting the oxygen and nutrients they need. The result? A tingling, numbness, or even stabbing sensation that comes and goes. Why does this happen? There are several risk factors that can damage arterial walls and impair peripheral circulation. A sedentary lifestyle. Spending many hours seated, in the office, in the car, causes blood to take longer to return from the legs to the heart. That slowness promotes fat deposits in the arteries. Smoking. Each cigarette damages blood vessels directly and accelerates the formation of cholesterol plaques inside them. With every drag, the arteries narrow and the flow worsens. High cholesterol. When levels of bad cholesterol, known as low-density lipoproteins, rise, fats adhere to arterial walls, forming what we call atherosclerosis, which narrows the blood's passage. Symptoms that accompany the tingling include cold feet. The lack of circulation causes a drop in extremity temperature. It's not uncommon to need multiple blankets or to warm your socks. Skin color changes, from a slight redness after walking to bluish or brownish tones on the toes, especially when exposed to cold. Cramps. Poor oxygenation causes muscles to contract painfully in response. To illustrate, think of Maria, 50 years old, and an office worker for a transportation company. For years, she spent more than 8 hours seated in front of her computer. She began to notice that, at the end of the day, her feet would prickle and go numb as she walked to her car. At first, she blamed fatigue, but over time she realized her toes were cold and slightly discolored. She visited her primary care doctor, who detected elevated cholesterol and warned her of possible peripheral artery blockage. How do you recognize the red flag? If the tingling in your feet is accompanied by very cold feet, skin color changes, pain when walking, or frequent cramps, it's time to pay attention. Don't let it pass as something unimportant. Poor peripheral circulation not only causes discomfort, but can progress to peripheral arterial disease, which increases the risk of ulcers, infections, and even wounds that won't heal. When should you see a doctor? If you notice that the tingling worsens with leg position or after long periods of sitting. If, when you elevate your feet, the color changes drastically and then takes a long time to return to normal. If the tingling is accompanied by pain when walking, muscle fatigue, or wounds that take too long to close. Early diagnosis through a simple Doppler ultrasound study or blood tests for cholesterol and glucose levels can make all the difference. With appropriate treatment, diet changes, specific exercise, weight control, and in some cases medication, you can improve blood flow, reduce tingling, and regain that awake feet feeling. The second cause of tingling in the feet is nerve compression, also known as tarsal tunnel syndrome. To understand it, imagine a narrow channel on the inner ankle, the tarsal tunnel, through which the posterior tibial nerve travels along with blood vessels and tendons. When that tunnel narrows, the nerve becomes trapped and begins sending signals of numbness, tingling, or even pain to the foot and toes. How does this compression happen? Forced or prolonged positions, spending many hours with the foot in excessive flexion, for example, wedging the ankle under a stool, crossing the legs too tightly, or squatting for long periods, can inflame the tissues surrounding the nerve. Inadequate footwear, overly tight shoes or high heels that force the foot's natural curvature put pressure inside the tunnel. Edema and prior injuries, swelling from old sprains, arthritis, or even a minor blow can reduce space and trigger compression. Typical tarsal tunnel symptoms include nighttime tingling and numbness. These often intensify when lying down and in a horizontal position, when inflammation presses more on the nerve. Radiating pain, a discomfort that starts at the ankle and runs down the sole toward the toes, sometimes feeling like electric currents or shocks. A burning or hot sensation. The skin can redden or feel warmer to the touch due to nerve vascular irritation. Intermittent tingling, spikes when rising after sitting or walking short distances. To illustrate, recall Mr. Luis, 73 years old, who loved strolling through the park. He bought a pair of trendy shoes, a bit too small to take advantage of the last discount. After a few days, he began to feel such intense nighttime tingling that he woke up several times. In the morning, he found it hard to place his heel properly, and pain shot up his ankle each time he walked. At first, he thought it was just a wrong size choice, but the discomfort persisted even when he discarded the shoes. Diagnostic tests. To confirm tarsal tunnel syndrome, the specialist typically recommends a physical examination. The doctor palpates the inside of the ankle, looks for areas of maximum tenderness, and performs specific maneuvers, like the Tinel's test, to provoke tingling by gently tapping along the nerve's path. Nerve conduction studies, using an electromyogram or nerve conduction velocity test. The speed at which the electric impulse travels along the posterior tibial nerve is measured. A slowdown indicates compression. Ultrasound or MRI. These allow visualization of the tunnel and rule out other causes, such as cysts, tumors, or tendon inflammation that might pinch the nerve. Treatment and relief. Changing footwear, choosing shoes with a wide toe box and flexible sole to free up the tunnel area. Night splints, devices that keep the ankle in a neutral position during sleep, avoiding excessive compression. Physical therapy, deep tissue massages, gentle stretches, and neural mobilization techniques that free the trapped nerve. Anti-inflammatories, targeted administration of drugs to reduce tissue swelling. Local injections, in more severe cases, an anesthetic or corticosteroid may be injected to relieve pressure. In Mr. Lewis's case, after adjusting his shoes, using a splint, and attending physiotherapy sessions, the tingling decreased significantly in a few weeks. He recovered his pain-free strolls and resumed sleeping uninterrupted. If you recognize these symptoms in your feet or ankles, especially that intense nighttime tingling, don't ignore it. A timely evaluation can prevent progression to a more serious compression and give you back peaceful sleep. Diabetic neuropathy is one of the most frequent and dangerous causes of tingling in the feet. It occurs when elevated blood glucose damages the nerve fibers in the extremities, causing them to lose sensation and provoking that persistent numbness or stabbing sensation. In a person with diabetes, excess circulating sugar acts as a toxin to the nerves. Over time, the nerve endings degenerate and their ability to transmit tactile and temperature signals diminishes. That's why patients with diabetic neuropathy not only feel tingling, but may stop perceiving extreme temperatures or small objects on the skin, which increases the risk of burns or wounds. Extra warning signs. Loss of sensitivity. There comes a point when the foot no longer responds to stimuli you used to notice easily. You can't feel the floor's texture or the touch of a sock. Sharp pain. Sometimes the tingling evolves into an acute or stabbing pain, especially at night. Wounds that don't heal, lack of sensitivity and poor blood supply hinder healing. A simple blister or small crack can become infected and spread without the patient noticing. Years ago, I met Anna in my neighborhood's walking group. She had battled type 2 diabetes for more than 20 years. At first, she barely noticed a slight tingle after long walks. Over time, she realized she couldn't feel water in the shower and that a small wound on her heel took weeks to close. When she finally saw a podiatrist, her foot already showed signs of a mild infection. That's when she was referred to an endocrinologist and a neurologist who confirmed advanced diabetic neuropathy. Importance of glycemic control. Keeping blood sugar within target levels is key to preventing or delaying neuropathy. Rigorous self-monitoring with fasting and post-meal glucose checks helps adjust insulin or other medication doses. A balanced diet rich in fiber and moderate in simple sugars reinforces this strategy. Regular follow-up with a primary care physician and a diabetes specialist allows early detection of complications. Foot examinations, monofilament tests to assess sensitivity, and nerve conduction velocity measurements help gauge the level of nerve involvement. Relief and prevention measures. Moderate, consistent exercise, walking or swimming, stimulates microcirculation and improves nerve health, always under supervision. Daily foot care. Inspect the skin, keep it clean, dry and well moisturized. Wear comfortable shoes and cotton socks. Vitamin supplements. In some cases, B-complex vitamins or antioxidants are recommended, always after medical evaluation. Specific treatments, medications such as anticonvulsants or low-dose antidepressants, can relieve neuropathic pain. If you have diabetes and feel tingling or numbness in your feet, don't ignore it. The sooner you act, the less nerve damage occurs, and the easier it will be to restore sensation. The fourth cause of that tingling in your feet may surprise you: nutritional deficiencies. When you lack certain essential nutrients, your nervous system loses its ability to transmit signals smoothly, manifesting as numbness, stings, or cramps. B-complex vitamins, especially B12 and B6, play a fundamental role in synthesizing the myelin sheath that coats nerve fibers. Without that protective sheath, electrical signals scatter or slow down, causing that tingling sensation. Vitamin B12 is found mainly in animal products, eggs, dairy, meat, and fish. Its deficiency impairs red blood cell formation and degenerates peripheral nerves. Vitamin B6 participates in producing neurotransmitters like serotonin and dopamine. Its shortage is often associated with irritability, seizures, and neuropathies. Magnesium is a key mineral for muscle relaxation and nerve transmission. When it's lacking, muscles contract involuntarily, causing cramps and that stiffness that blocks proper impulse flow. Sources include nuts, legumes, whole grains, and leafy greens. Common deficiency causes are very low-calorie diets, intense stress, or excessive fluid loss through sweating. Nowadays, many people follow trendy diets without professional supervision. Plans that eliminate entire food groups can lead to deficiencies not only in vitamins and minerals, but also in proteins and healthy fats, essential for nervous system structure. Conditions like celiac disease, ulcerative colitis, or even age-related intestinal changes can reduce nutrient absorption, leaving the body in silent deficit. Associated symptoms: painful muscle cramps and spasms in the calves, foot muscles or thigh. Muscle fatigue, feeling heavy legs after walking just a few yards, dry skin or cracks. Lack of B vitamins also affects skin health. Sleep disturbances, lightheadedness, and nighttime tingling that interrupt rest. To illustrate, think of Paco, 48 years old, who tried a very low-calorie diet to lose weight quickly. For weeks he ate only salads and green smoothies, convinced it was the most effective route. After about 2 weeks, he began to experience intense cramps upon waking and constant tingling in the soles that prevented him from concentrating at work. A dietitian discovered his B12 levels were below recommended and his magnesium intake was virtually zero. With a supplementation plan and a more balanced diet, within weeks he regained muscular energy and the tingling disappeared. Recommendations to evaluate deficiencies. Medical consultation and blood tests Complete blood count and levels of B12, B6, magnesium, calcium, and potassium. Diet review. Keep a record of everything you eat for a week, noting amounts and times. Assessment of associated symptoms, frequent cramps, fatigue, skin or sleep disturbances. Guided supplementation. Do not self-medicate. Use supplements only under professional guidance. Nutrition education workshops. Attend talks or workshops about a balanced eating plan that covers your age and activity-specific needs. Ruling out or correcting a nutritional deficiency can be as simple as adjusting your weekly menu, thus making your feet feel awake again. If your doctor confirms low levels of any of these vitamins or minerals, act promptly. Replenishing them is the first step to restoring your extremities' nerve health. The fifth cause of that tingling in your feet lies in the lumbar spine, where nerve roots can be compressed by a herniated disc or other anatomical changes. This condition is called lumbar radiculopathy and causes pain or tingling to run down from the lower back into the leg and foot. Imagine the spinal cord as a tree trunk that, at its base, branches into nerve roots for each leg. Between each lumbar vertebra is a disc that acts as a shock absorber. When one of these discs shifts or ruptures, it presses on the corresponding nerve root. That pressure alters the conduction of electrical impulses and can cause radiating lumbar pain, a stabbing sensation or cramp in the lower back that sometimes immediately shoots into the buttock and the back or side of the leg. Leg weakness, difficulty maintaining strength when walking, climbing stairs, or even lifting the foot. Tingling and numbness, that sleeping carpet feeling under the toes or on the sole, which worsens when sitting or bending the torso forward. To illustrate, consider Marta, 65 years old, who enjoyed long neighborhood walks. One day she noticed a slight buzzing in her right foot, as if something was moving beneath her skin. Weeks later, the buzzing turned into numbness, and a stabbing pain appeared in her lower back that didn't subside with rest. Marta thought it was a footwear issue or a muscle strain. However, after a month of constant discomfort, her doctor ordered an MRI of her lumbar spine. The study revealed a herniated disc at the lumbosacral vertebra compressing the sciatic nerve root. Early diagnosis allowed for targeted physiotherapy and, if necessary, evaluation for surgical decompression before partial paralysis became permanent. Imaging studies and the importance of early diagnosis, plain X-ray, may show indirect signs like reduced disc space, but doesn't visualize the herniated nucleus. MRI, the test of choice to identify the size and exact location of the herniated disc and assess nerve compression. CT scan, useful when MRI isn't available or is contraindicated, shows bone structures and the spinal canal. Electromyography helps evaluate nerve function and differentiate radiculopathy from other peripheral neuropathies. Why acting promptly is crucial. Prolonged compression can irreversibly damage the nerve root, causing chronic pain or permanent muscle weakness. Early physiotherapy complements medical treatment with flexibility exercises, stretches, and core strengthening to relieve pressure on the nerve root. When necessary, decompressive surgery has better outcomes if performed before severe muscle atrophy sets in. If you feel tingling when you rise, accompanied by lumbar pain or leg weakness, don't assume it's just a simple backache. Consult your primary care physician or a spine specialist. Over the years, I've heard all sorts of explanations about foot tingling. Many of them are simple myths that can delay a real diagnosis and worsen the problem. Let's debunk 3 of the most frequent beliefs. Myth 1. It's normal with age, you just get stiffer. While it's true that nerves and blood vessels lose some elasticity over time, not all tingling is explained by aging. Persistent numbness, stabbing pains, or tingling that doesn't go away after a short rest indicate that something is significantly altering nerve function or blood flow. If everything were normal with age, there'd be no difference between fleeting tingling after sitting and tingling that disrupts sleep or impairs walking. Correction: don't automatically attribute tingling to age. Seek the underlying cause and treat the root problem, not just the symptom. Myth 2. Only high-performance athletes suffer from it due to overexertion. It's common to think foot tingling only affects those who run long distances or lift heavy weights. But the reality is, that anyone can experience it. Sedentary behavior, poor dietary habits, or bad sitting posture are just as culpable as excessive training. An office worker sitting with crossed legs, an older adult with diabetes, or someone wearing overly tight shoes is as exposed to those sensations as an athlete. Correction. Recognize that tingling affects different profiles and that both inactivity and intense activity can trigger it. What matters is identifying your specific factor. Myth 3. Just wear looser shoes and it'll go away. Certainly, appropriate footwear helps, especially if the cause is nerve compression from tight shoes. However, if the tingling stems from poor circulation, diabetic neuropathy, nutritional deficiencies, or lumbar radiculopathy, loosening your shoes will only provide momentary relief. An overly soft sole or unsupportive shoe can even worsen spinal issues or gait posture. Correction. Choose comfortable anatomical footwear, but don't stop there. Combine it with exercises, medical checkups, and healthy habits to treat the real cause. Debunking these myths is a fundamental step towards stopping the perception of tingling as an inevitable nuisance and starting to treat it properly. If you still believe any of these myths, think back to your last medical appointment or a specialist's advice before deciding it's normal and carrying on without further action. We've covered 5 causes, debunked myths, and given practical advice. Now comes the most important part, knowing when you shouldn't wait any longer and need to see a doctor. Warning signs you mustn't ignore: leg or foot weakness that prevents safe walking. If you notice one foot dragging or not supporting your weight, it may indicate severe nerve compression or radiculopathy. Complete loss of sensation, feeling nothing over a wide area of the foot or calf is not normal. It indicates extensive nerve fiber damage. Intense, constant pain, especially if it worsens at night or with movement. Pain that doesn't respond to conventional analgesics can signal neuropathy or a structural spinal issue. Wounds on the sole or toes that won't heal. In diabetic neuropathy, even a tiny wound can get infected with barely any pain. Drastic skin changes, redness, swelling or cold, pale areas, especially after walking or sitting, signal peripheral circulation problems. If you experience any of these symptoms, don't wait for them to pass. Early consultation can prevent irreversible consequences and improve your quality of life. Recommended tests and specialists: neurology for nerve conduction studies or electromyography to assess your neural network. Endocrinology if diabetes or metabolic alterations are suspected, since good glycemic control and vitamin testing protect your nervous system. Orthopedics or traumatology, especially if the tingling originates from the spine or joints. They usually request MRI scans and X-rays. Angiologia for poor circulation, to perform arterial Doppler ultrasound and evaluate blood flow in the extremities. Final reflection. Foot tingling is more than a passing nuisance. It's a message from your body demanding attention. It could be a warning of a narrowed artery, a trapped nerve, poorly controlled diabetes, a nutritional deficiency, or a displaced lumbar disc. Understanding its origin is the first step to regaining your well-being and walking without fear. Call to comment. Now I want to know from you, which of these causes surprised you the most? Have you experienced any of them? Share in the comments. Your testimony can help others going through the same. Farewell. If you found this video useful, give it a like, subscribe, and share it with those you think need it. That way we can keep creating content that makes a difference in your health and daily life. Thank you for staying with me until the end. Take care of those feet, and see you in the next video.